Thank you very much for staying with us. Now, approximately 19,000 people die each year due to air pollution in Kenya. This is according to a report by the World Health Organization, which places Nairobi as one of the polluted cities that is killing its citizens. Now, while vehicle emission is the biggest contributor to air pollution, at the center of all is the fumes in a special, rather, at the center of all the fumes is a special group of people that are mandated to control the traffic at the expense of their health. Amwai brings you this special feature dubbed Checking on Duty that highlights the dangers that traffic police officers face while ensuring that you travel in a controlled manner to save time.
Nairobi, the green city under the sun. The streets of the capital are busy all day, traffic bumper to bumper, with individuals rushing against time to either get to work or get home. Thousands of vehicles drive in and out of the CBD in a day, and with each engine turned on, one thing comes out: vehicular emission. A threat to the very environment we depend on for survival. As the rush to get to the destination is amplified by each acceleration, the toxic fumes become the new reality of pedestrians using the roads. However, there is a faction of people left out of the equation, the traffic police officers, whose job is to control the very traffic that is killing them one vehicle at a time as they choke on duty. When they are busy controlling traffic in the city and ensuring that everything is moving, they expose themselves to dangers that do not need a gun. Exposure to air pollution has great impact on the respiratory system, as Dr. Navid Merali explains.
Air pollution itself has got a very big problem in our airways. The molecules or the chemicals that are produced by these gases are what we call as free radicals. These free radicals cause harmful reactions in the airway by leading to excess inflammation. This is a very similar pathway to how cancer cells are formed, whereby there is persistent damage or free radical formation in cell tissue, and this leads to cell damage or chronic cellular damage. Air pollution then increases the risk of airway diseases. Some of these diseases are what we know as asthma. They can lead to chronic obstructive pulmonary diseases. They can lead to increased incidence of chest infections, and they can even lead to an increased risk of lung cancer or other malignancies as well.
Paul Sigilai is a chief inspector and works with the traffic department. His work entails being on the streets to control traffic. Inspector Sigilai says he has been controlling traffic for over 3 years now and attests to the fact that his health has been affected as a result.
I've been on the traffic department for about almost 3.5 years, yes. In the 3.5 years in the CBD. Yes, there's numerous challenges, particularly the fumes. The fumes aren't that good for human health, and on some occasion I've also gone to the hospital for medical checkup, having the chest congestions occasioned by dust and fumes in the CBD. And the challenges are there, indeed, the challenges of exposure. Putting in mind that the fumes also affect the environment, the ozone layer. So if you can imagine it is affecting the ozone layer, what about the human beings?
The posting of officers is rotational, with each one of them lasting 8 hours on the road and at times even more, which leads to more exposure.
These are the same officers who will be here for the whole month, and we keep on rotating them. Sometimes they are here at the railways roundabout, sometimes they are the highway, Uru Highway. Now, the rotation happens on a weekly basis.
Their health is on the line as they continue to call for sick-offs.
Some officers do report cases of inspection, particularly chest infection, a lot of congestion. The officers spend more time actually standing and walking, and they rarely have time to rest because the traffic duty is very demanding. We have the congestion, the traffic jam, and you hardly get time to go and rest. You only have maybe 5 minutes You go and have a little, a cup of coffee, then back again.
So what measures do officers take to protect themselves from the effects of pollution as they carry out their duty?
On the part of emission from exhaust fumes of motor vehicles, we actually tell them to put on masks, and most of them have masks in town. You see, they have masks which will actually prevent what we call toxic contaminants which are emitted from the smoke of motor vehicles from getting to their respiratory system.
Without proper equipment while on the road for hours and hours, their vulnerability is evident because the more they take in, the more their system weakens.
The longer you are exposed, or the longer you're exposed to harmful gases, the worse or the higher the risk of your development of airway diseases, and the higher your severity of these diseases becomes. If you're going to be out in the street like a traffic policeman, smack in the middle of a busy highway whereby there's lots of cars, there's lots of exhaust fumes, you can expect that such a person is at a higher risk of developing chronic lung disease.
Vehicle emission have proven to be toxic because of the compounds released during combustion. The chemical components after combustion proving to be dangerous not just to humans but also to the environment.
Yeah, because you have dust, of course, and like I said, you have also components that have not been combusted. You get to have particles in the air, and those particles in the air, which we refer to as particulate matter, will have your COs and NOs and SO2, SOs. Those are components that have been emitted from the engines being adsorbed, that is stuck onto the particulate matter, which we call dust. And therefore you're inhaling compounds or chemicals or molecules that are attached to dust, and that is where our story starts with our health.
While ozone is an invaluable compound in the upper atmosphere for our continued existence, when it forms on the ground level as smog, it has a vast array of health issues that come along with it.
There is also what we call as ground level smog. Ground level smog is composed of poisonous gases that create a thick vapor that we end up inhaling. That is mainly as a result of car exhaust gases, diesel engines, and sometimes also from factories.
The use of masks has been fronted as one of the best ways in which one can protect oneself from the effects of air pollution.
There are two ways to look at it. The first is, what can the everyday Mwananchi do? And one of the easiest things to do is to wear a mask. Masks, even though sometimes they're uncomfortable, reduce the amount of particulate matter, like soot, that you inhale. They may not reduce the amount of, the regular mask may not reduce the amount of gases that you inhale, but the amount of fine particles that will be reduced. There are specialized masks called which have got devices that can convert the harmful gases into less harmful ones, but I don't think that's something everybody is going to have access to or wear. Some of the things that we do, for somebody who has no choice but to be in a polluted environment, wearing a mask is an easy solution.
So what should people exposed to pollution look out for after exposure?
The most common respiratory symptom generally is cough. And yes, with pollution, the most common symptom will still generally be cough. But it varies. For example, an asthmatic exposed to air pollution may start wheezing a lot more. Or, for example, an asthmatic somebody who's not asthmatic, exposed to a high amount of pollution, may either develop asthma-like symptoms. They can develop coughing, they can develop wheezing. Some people can develop shortness of breath, but it depends, because air pollution is also linked to cancers, and they may be a higher risk of developing lung cancer as a result of chronic exposure to pollution.
The state of air quality in Nairobi still needs some working. For the month of May, from the 12th to the 22nd, the air quality in the city has been majorly moderate. At the beginning of the month, most days experienced good air quality due to the heavy rains witnessed in the country. During the month of May, different areas including Kariobangi North recorded unhealthy air quality, which was unhealthy for sensitive groups. Other affected areas include Nyerere Road, which surpassed the unhealthy mark, registering 102, with other areas registering moderate quality. The areas include Dandora Phase 4, Kangemi Health Center, Nairobi National Park, Kariobangi North Health Center, Nyayo Estate Gate B, Nyayo Estate Gate D, Elk Office, Nyayo Stadium and the Aga Khan Academy. An estimated 40% of Nairobi's PM2.5 air pollution concentrations are attributable to road transport. PM2.5 is fine particulate matter that is 2.5 microns or less in diameter. These tiny particles are inhalable into the lungs and can induce adverse health conditions. The rise in PM2.5 concentration in Nairobi is primarily due to the presence of large and aged vehicle fleet, inadequate road network, and poorly enforced vehicle emission standards.
The regulations require that they make a requirement for testing of vehicles. But that requirement, we were not able to operationalize it because we didn't have standards for the vehicles. Recently, the vehicle emission standards were adopted by the East African Community member states. That's in 2022. We adopted the standards. We have also amended the regulations, the air quality regulations 2014. We are waiting for the gazettement of the air quality regulations 2024, which have standards for the vehicle, because we could not operationalize that without one standards.
Despite accounting for only 9% of the population, the city hosts over a third of the country's 3 million vehicle fleet. However, only 12.8% of Nairobi residents possess vehicles.
The population in Nairobi is very, very high, yeah, and the population of humans in Nairobi is also very high. Given that every young guy, you, me, my young brother, whenever they get a job, the first dream they have is to own a car. Okay, could be operating from the same estate, living for the same job place, but everybody would be happy driving on their own beast.
Pollution is among the leading causes of death in Kenya, especially in Nairobi. The World Health Organization estimates that 19,000 people die annually in Kenya due to air pollution. The United Nations Environment Programme UNEP report shows that of the total death in Kenya resulting from air pollution, Nairobi accounted for 70% of those deaths, indicating the high degrees to which air pollution is prevalent in Kenya's capital. As of May 2024, data from IQ Air shows that 490 people have so far died from air pollution in Nairobi. Experts have warned that Nairobi's air quality is getting worse each day, with particulate matter PM2.5 levels getting higher than the recommended limit by WHO.
Especially in our city of Nairobi, where there are hundreds and thousands of cars on almost every major road. People are walking next to the cars. There's lots of exhaust fumes. There's lots of factories. If you go to industrial area, you'll see there's lots of smoke. You can even see the air is not very clear. And if we look at Nairobi's air quality index, which is what we use to assess how good our air is, Nairobi's air quality index is rated as moderate. Moderate is generally unhealthy. This puts vulnerable people, especially asthmatics, people with airway diseases, people with chronic lung diseases, at risk of having increased flare-ups, increased admissions. It really just becomes a big problem.
The government, however, has measures in place to help mitigate the effects of emission.
So anytime these amended regulations are gazetted, we will roll out vehicle emission testing. It will be a requirement that when for private vehicles it will be once after every 2 years. Commercial vehicles it will be once annually. Okay, we will be administering stickers, emission compliance stickers for vehicles that have complied with the requirements. Upon testing, we will designate testing centers where people, owners of vehicles will be required. Once these regulations are gazetted, owners of vehicles will have to take their vehicles there for testing. Once they pass the test, you get a sticker.
The biggest challenge to dealing with unroadworthy vehicles has been the lack of proper regulatory standards. The voice on what should be done is uniform across the board, with the threat on health very evident.
So it is true, when you have a vehicle that is stationary, the bus stops, when vehicles are picking passengers and the exhaust are directed to the bus stop or to a shop next to the bus stop or a kiosk, then you have very high concentrations of the compounds that that has been exhausted and are inhaled, and over time the individuals get into more health issues.
If we were to reduce the number of motor vehicles on the highway, the amount of air pollution would go down. More sustainable transport systems that, for example, other countries have implemented include like electric trains, or having specialized roads that can accommodate many cyclists, tends to reduce the amount of noxious gases produced.
Currently, Nairobi, the network monitoring is still very limited, because most of the monitoring sites are concentrated in some few areas, but some areas have no monitoring equipment. Secondly, this data, we don't have a central repository where we can access this data.
The sun sets in the green city under the sun. Pedestrians and traffic officers who have been busy working around the clock to fend for their families retreat home with conditions that are slowly taking their lives.
Normally we deploy the officers for 8 hours. We've got the first and the second shift, and the first one begins at around 5 in the morning, and that one runs until sometimes in the day around 2 or thereabout. Then the second shift begins until almost 10 p.m.
Traffic officers who have cleared the roads are now forced to struggle to breathe, with lungs choking on duty. And as the vehicles continue to flock to the streets, so does the smoke, reducing the quality of air. Visions become blurry, indicating that for those exposed to poor air quality, their future is bleak and an emission away from death. Brian Amwai, Look Up TV, Nairobi.